Have a seat. Good afternoon, everyone. You all know me as Diana Henson. I'm a student from Kaiser University. Today, I'd like to share with you the information regarding transient ischemic attack, also known as TIA. I appreciate your time and attention as we explore a very delicate subject. I trust that the length of my speech should run about 10 minutes and will give you a good overview of the serious health condition. TIA is not important until it happens to you or someone you care for. Then it becomes an all-absorbing and life-changing situation that can be frustrating to deal with and altogether overwhelming for both the patient and the caregivers. The American Heart Association, eMedicine Health, and other experts in the medical field explain what is TIA, what are the symptoms and causes, and what are the medical tests used to diagnose the condition. Medical experts have also looked upon information regarding prevention and medical treatments, as well as some of the effects it has on the patient and their caregivers' daily lives when managing transient ischemic attacks. Let's begin by looking at the most important information you'll need to have regarding TIA. Transient ischemic attack is a potentially life-threatening medical condition that should be carefully monitored by doctors whose patients have undergone these attacks in order to prevent a more serious condition called stroke. Together we will be exploring the causes of transient ischemic attacks and any other possible underlying conditions that could be causing a TIA. This not only eases the patient's concern by keeping them informed, but allows for them to participate in managing their care. We'll also go over the more common symptoms and the medical exams used to diagnose TIA. Recognizing the symptoms of a TIA can not only assist in preventing a more serious side effect, but also empower the relatives to make decisions when they feel more aggressive care is needed for their loved ones. Then we will review the types of medical exams that are used in diagnosing and managing this condition in order to familiarize you with the process. We will conclude with information which will empower you to seek treatments and prevention methods that are being used today. Included is some information regarding the lifestyle changes and challenges that patients and their families face during this process. What is a transient ischemic attack? What are the causes and possible underlying conditions? Well, according to the American Heart Association, a TIA is a warning stroke or a mini stroke that produces stroke-like symptoms but no lasting damage. This is initially good news for the patient, where a TIA usually lasts anywhere from a minute to 5 minutes and does not cause permanent damage to the brain. Research has indicated that individuals who have suffered a TIA are likely to have a stroke within a designated period of time after initially experiencing a TIA. The time frame can be anywhere from days up to a year. They estimate 1/3 of patients that have experienced a TIA will at some time have a further complication of a stroke. The encouraging news is that 2/3 of these patients do not develop any further complications. It's important to remember that while TIAs have similar symptoms to a stroke, they are short in their occurrence and leave no lasting damage. Medical experts explain that TIAs are caused by a lack of blood supply to the arteries in the brain by blood clots that prevent oxygen from circulating through the brain. These blood clots are formed when fatty acids in the blood collect within the arterial walls and with time cause a narrowing of the interior walls. The gathering fatty cells eventually form a plaque, which can break off and flow throughout the body and find its way into smaller arteries in the brain. That'll cause a blockage of rich oxygen carried through the bloodstream into the brain. This temporary loss of oxygen can cause the surrounding brain cells to lose function. In order to understand the causes of a TIA, consideration has to be given to the risk factors such as a high blood pressure, high cholesterol, diabetes, smoking, and family history. These are all important factors in the development of a TIA. What are the symptoms of a transient ischemic attack, and what medical exams are used to confirm a diagnosis? Well, according to eMedicine Health, loss of speech, aphasia, is associated with weakness or numbness of the right side of the body. Other symptoms can include sudden numbness or weakness on the face, arm, leg, especially on one side of the body, confusion, trouble speaking or understanding, trouble seeing in one or both eyes, trouble walking, dizziness, loss of balance or coordination, and severe headache with no known cause. Another important thing to keep in mind is that depending on what area of the brain is being affected, it will affect a particular portion of the patient's anatomy. TIA symptoms can vary depending on what side of the brain is being affected. The left portion of the brain will affect the right side of the body, and the right side of the body will affect the left side of the body. It is especially important for a patient to make note of any changes in their experiencing throughout the day and advise their physician of any notable symptoms. On the chart you can see the brain affecting the right side of the body and the left side of the body brain affecting the right side of the body. These are the different compartments of the brain that affect different parts of the body. Over here on this side. Your physician may make careful consideration of the changes in symptoms and may order specific exams to confirm the diagnosis. An electrocardiogram is one of the most important useful exams in order to monitor irregular heartbeats in a patient with high risk factors for TIA or stroke. Radiological exams like a CT scan of the brain are used to review whether any bleeding of the arteries of the brain have occurred, or carotid ultrasound to detect if there has occurred a narrowing in the arteries that may cause further complications. Routine physical exam to monitor the risk factors will often include blood work, called CBC, that will check the adequacy of the blood count and platelets in the body. This process is critical in monitoring the potential for clots or narrowing to form in their arteries that will increase the risk of TIA or stroke. What treatment is prescribed for transient ischemic attacks, and how can prevention make a difference in the care of a patient? Well, prevention is the most important aspect of a TIA, and ultimately to prevent a major stroke. Lowering blood cholesterol and monitoring blood pressure are of the utmost importance. Doctors may prescribe medications to lower cholesterol in addition to medications to keep blood pressure at an optimum level. In addition, an aspirin a day, other anticoagulants, or blood thinners may be prescribed in order to keep the blood supply as fluid as possible. In extreme circumstances where an artery has narrowed and become obstructed, the patient may undergo a procedure called endocardotomy in order to unclog the artery. The most important part of monitoring a TIA is prevention. It can be at times difficult for a doctor to diagnose a patient with TIA that has been unconfirmed because of the numerous symptoms that can also be attributed to the underlying conditions: hypertension, diabetes, heart disease, arteriosclerosis, thrombosis, carotid artery stenosis, artificial fibrillation, and high cholesterol may not only be underlying conditions, but also risk factors for a TIA and ultimately a stroke. TIA becomes a life-changing event for many patients that have suffered the onset of the symptoms. It is a life-changing event that, if not treated and monitored carefully, will lead to further complications that cause paralysis and even mortality. Living with TIA becomes a challenge for the patients and their families. The strict regimens of medications, healthy diets, exercise, rest, and a stress-reduced environment can at times be an almost impossible task to accomplish for active families. The added stress of doctor appointments and endless exams need to closely monitor the patient's care become the focus of the family's daily activities and may redirect their lives into an unwelcome ritual of medical intervention. The frustration is mounted by the helpless emotional feelings that the patient and the relatives feel when prevention has not been accomplished, and they find themselves desperately trying to cope with the onset of these emotionally charged events. A patient's best option to gain control of their condition is to monitor their symptoms closely in a log, take care to follow their doctor's advice, and take their medications as prescribed. It might be helpful to seek self-help groups or some professional counseling in order to help them deal with the changes they're experiencing in their lives. Caregivers and relatives should become informed about TIA and all that entails the care of their loved ones. What would be most important, however, is to be aware of the symptoms of a TIA and to act appropriately and quickly on their loved one's behalf. The prominent individuals in the patient's lives could be the first response in saving their loved ones' lives and acting quickly and effectively. What I trust you gather from this speech today is to become informed about the most important aspects of transient ischemic attacks. What are its causes, symptoms, medical exams used to diagnose it, and the treatments of preventions, the steps that are to prevent deterioration of a patient's medical health in order to help you take an active role in managing your care. Managing your own preventive care will be critical to the future prevention of further complications from a TIA. Educating yourself about the causes, symptoms, exams, and underlying conditions will help you to adjust your daily living routine in a more health-conscious manner. Take the appropriate changes in your lifestyle and discuss them carefully with your physician, what actions you can actively take in managing your care. I trust that the information you've learned today will give you a better understanding of what to openly discuss with your physician and caregivers to accomplish a healthier lifestyle. I appreciate your time and trust you will have learned useful information that will help you in the near future.